topic of social justice that is particularly interesting and relatable to my personal beliefs is the social stigma that surrounds addiction amongst people and how that belief is misdirected. People suffering from addiction are commonly referred to as being bums, deviants, fiends, and lowlifes. In fact, many facets of our society associate addicts with these qualities regularly and systemically. Stigma impacts society on micro, meso, and macro levels. In particular, the effect of these stigmas impacts individuals with substance use disorders when attempting to navigate the recovery process and make simple improvements to their socioeconomic status. Additionally, the stigma associated with substance use impacts healthcare providers, governing policies, research, and the justice system as a whole. As defined by the Global Qualitative Nursing Research Journal, stigma refers to attitudes, beliefs, behaviors, and structures that interact at different levels of society and manifest prejudicial attitudes and facilitates discriminatory practices against people with mental and substance use disorders. The power of stigma is astronomical. The influence that stigma presents to people who suffer from substance abuse disorders is felt in every aspect of their lives. One example of systemic injustice that resists contemporary research is how the criminal justice system in the United States has incarcerated people found with personal quantities of illicit mannered substances. Federal and state agencies granting assistance for living space and funding limit individuals' access to such programs after they receive guilty verdicts for possession of these substances, even after making full recoveries. Massive conglomerates that dominate the socioeconomic landscape of the United States design the substances, prioritize profits over people's lives, and publicly denounce the populations that are diseased by their poisons. The most notorious example of this in contemporary times is Purdue Pharma's contribution to the widespread opioid epidemic that still has its claws in American populations now more than ever. The company knowingly distributed a highly addictive, synthetically derived opioid called OxyContin to patients across the United States while simultaneously altering the clinical data, medical consensus, and consumer affection surrounding the true implications of using this drug. In addition, the company is accused of bribing and kicking back payments to MDs and political figures in efforts to increase the drug's written prescriptions, its sales, and profitability. This is just one example of how people who suffer from substance abuse disorders have been treated as targets rather than people in need of medicinal and therapeutic intervention. Rather than penalizing populations with substance abuse disorders criminally, economically, and socially, this nation needs to reform governing policies that instill encouragement and support to those who are receptive to seeking treatment, as well as banish practices that permit the permanent defamation of character.